Shifting to your academic pathway, you shared that I believe you said it like you had a love for arts, but you were smart enough to do STEM work.
Mm.
You continued on to earn a Bachelor's of Science in Human Nutrition, Pre-Medical Sciences with a minor in Spanish from Oklahoma State University. So tell us about that thought process going into undergrad, and then how did your undergrad experience shape your understanding of public health and nutrition?
Yeah, I would definitely say before entering Oklahoma State, I uh, joined a summer pre-matriculation program that definitely influenced my decision to switch from University of Tulsa to Oklahoma State. And that was partly based off, again, what the research shows and what my research now is on belonging. That when young people feel, or anyone feels belonged in environments like universities, they improve and succeed academically. And so that seed was first planted there. I was formed friends. I was getting college credit, like knocking out my math and English, studying, understanding the research labs there, what opportunities. And so every summer, since really ninth grade, I've been at some university, medical school, um, doing a STEM summer program, and that all has built like a culminating experience on top of one another. So I went in really with a focus, even before thinking about military schools, to be a bilingual military teaching physician. I switched to just preventative health physician, knowing that I would be interested in lifestyle medicine early on, just by looking at family members and what can be prevented. Since I saw everything from diabetes type 2 to coronary heart disease, breast cancer, lupus, and fibromyalgia, just a range of issues that I thought, not all of this can be genetic. Some of this has to be preventable, but I got to figure out how. And so one summer, right after my freshman year at Texas Children and Baylor Med and Rice, again, just doing more coursework and working with Dr. Steve Abrams in pediatric nutrition research and neonatology, made me realize, like, oh, nutrition is a real science. Yeah, as I later switched to nutrition my sophomore year, our dean, not Dean Knob, she would joke around like not having any brooms as if it was a home economics school, because that was the joke by the math department folks, of what HES at the time stood for, which was Human Environmental Sciences, now just Human Sciences. But I've valued the training there. I think because of the nature of science, sometimes, it's almost like accounting. You can lose the sense of humanity when you just drill people down to zeros and ones. And so being over at that college, it really was about, taking human development, understand the life process in nutrition and aging process, and just appreciating all the different stages of life that we endure, and how does it change? How do our needs change? Our physiological needs, as well as nutritional needs and societal needs. And so that information has carried on with me ever since, while doing bone mineral research and botany research throughout my undergrad career. But I knew if I were to stay in Oklahoma for my education, that I still needed to get exposure to other environments, just to round me up and realize the full possibilities that were available. So I was very intentional, very self motivated, because I just really believed in myself and believed in the possibilities of like why God put me on this earth to do purpose driven work. So it was not an advisor. I won't say I just pulled myself up by the bootstraps, but I definitely was the captain of my ship. And I remember even in graduating, I read that poem and a few others that were like driving forces and motivating me. So after that summer of my freshman year, I went, from Baylor, then to UPenn, where I met really my first Black nutrition researcher, Dr. Shariki Kumika, who's at Drexel now, but she was heading up the HELP study, which was focusing on healthy eating lifestyle program, looking at African American and Latino communities. And that was the first time, like, it's one thing to study community nutrition in a class. It's another thing to design interventions in the community and factoring, all the things that, everything from childcare to transportation, what prevents people from being recruited into studies, as well as doing the transcriptions and asking the right questions. And so that was a good break from being in like bench work lab, working with rat models to like see this human studies that are being designed. And then, going to Harvard Public Health the next summer, again, still doing human studies, but community focused out of WIC centers, focusing on a Dominican population of mothers in a maternal child health and nutrition study. And that really was the spark for me to want to go abroad, because being on the East Coast by then, that was my first time being in Philly, being in Boston, seeing people who, even though I had a Ghanaian stepdad early in life, and knew that there were people not born in America, that was really evident being on the East Coast, just by the nature of, how migration patterns flow. And so meeting people from Haiti, from, DR, it really kind of like put the light bulb of like, wow, I want to study like the etiology of how they think about systems in public health. And so I got the Born National Security Scholarship to fund me to go to study at Pucamaima in Santiago in DR. And that was eye-opening and really planted the seed of the travel bug, because by then I am working not only in the Bate, which is a Haitian migrant community, where we're doing health charlas, just they were like just health talks with the community health workers around, sexual health issues, but also studying the healthcare system, doing tours with the different provinces, private care, public care. What does social medicine look like? Why, when people come to this country, they're like, I don't want to be a part of nobody's public programs, by way of looking at what they've come from. So to me, that was really eye-opening to understand the cultural orientation. We had a course at Tufts, because by then the trip and study abroad to DR was the bridge between undergrad and grad. And when I then started to study at the graduate level and taking, sitting in courses on race, healthcare, and ethnicity, and hearing about cultural orientation, because again, I didn't really realize like how this culture play a role in health. Is one thing to think demographics, like, oh, you're Black, you're Asian, whatever, but what does that really mean from a psychographic perspective when you think about immigration as an identity, as much as the religion layered on, education, class status? Like, all these are additional layers that determine like one's ability to take in information, process it, and actually utilize information. And so I became even more mindful and sensitive to like all these different identities that we now understand as intersectional identities, and how people navigate systems, and public health systems included, and how they, take in messaging, and how do they actually change their behavior or not. Because if we don't have that appreciation, we go and blame people and patients and consumers of like, why don't they just do X, Y, and Z? And I think that's very insensitive, and does not take in the full humanity of people. And unfortunately, in the making of the field of health comm, as there was a hashtag at a recent health comm conference I went to a few years back, HCOM so white. It was a trend that was acknowledging, how it was founded, how did it actually take in different lived experiences, and how do we begin to look at the scholars in the space diversifying and bringing their own, not only ideologies, but really conceptual frameworks that are factoring in these other cultural elements that need to be considered in designing out programs.